When we're young, we move with freedom and confidence, with a great resilience to injury. But somewhere along the line, we develop poor habits and become more vulnerable to back pain. Back Pain Solutions features evidence-based and practical advice to help you take back control of your health and get back to the activities you love. This is your guide to better back health through movement. So join us as we demystify some of the commonly held beliefs about back pain and build your confidence to a stronger back the smart way.
Okay, welcome back to the Back Pain Solutions podcast, everybody, with me, Ben James, and as always, my co-host, Jacob Stain. Today, we're talking hip pain, or is it hip pain? Is it back pain? Is the hip pain being referred from the back or vice versa? This is often a question that we get asked by patients, or certainly a symptom that we see from patients experiencing back troubles, that they experience some hip pain as well. This specific episode we decided to create because of a listener's comments and email to us. So Derek from the US, thank you for the feedback, thank you for the review, and thank you for posing the question, because it is an interesting topic for discussion. So as always, before we start, take advantage of our ebook. Get on over to our website, www.smartstrong.co.uk. Download the ebook, start taking back control of your back health and your back pain today so you can get back to the activities that you love. So Jacob, hip pain. This is often a bit of a confusing topic for patients, because sometimes they will kind of focus on that hip pain, or they come in with hip pain, and if we're just being symptom based, then we can get led down a track of focusing on the hip and discounting the lower back. And that often seems to be how some patients come in to see us. They'll have seen other practitioners, they'll have focused on the hip, but actually the problems in the lower back. Do you see the same things?
Yeah, exactly. And I think that's where a lot of people, because a lot of people have the idea that the hip joint itself sits on the side of the body, on the side of the upper leg here, next to the glute muscles. And I think a lot of the confusion is it's easy to solve the confusion by understanding the anatomy, and that's what I usually do with my patients. I first go into telling them exactly where they can find the hip joint, and that hip joint pain would actually present very different to what they're feeling, pointing to the side of the hip, on the side of their glute. And so, just like you said, then you have this big confusion. Well, what is it exactly? Because it's not a sharp pain. It's not a pain that comes specifically by using my hips, other than when you would have a hip pain or a hip problem, a real hip injury. But it would be maybe from walking long distances or sitting for a long time. And so then you should become a little bit suspicious to what is the actual cause.
Yes. Yeah, no, it's a good point. I think it's that kind of pattern recognition, isn't it? But also, I think quite often people kind of misunderstand where that pain actually is. And when they describe hip pain, it's not necessarily the hip at all. So that's a bit of an educational piece as well, as always, that we discuss about the importance of the educational element from our side as practitioners, and informing patients about their anatomy and about their health in general. And this is certainly one good example of that, where that hip pain actually is more buttock pain, and it's not a deep kind of joint pain that you would expect from a true hip injury or a hip issue.
Exactly. And so you got to ask yourself, why do I feel it on the side of my buttock, the side of my hip? And so we as practitioners, we look at pain in different ways. It could either be a locally caused pain, or it could be a referred pain. And what you see often with this is it would be a low back injury that refers to the side of the buttock.
Mm-hmm.
And it can also refer even more to the front, to the side of the hip, but more to the front side of the hip. And that's where we often get the confusion of hip pain instead of...
Yeah, that kind of groin discomfort is often
Exactly.
communicated by patients. Yeah.
Exactly. Yeah.
And without going into too much depth, a lot of that is down to the kind of neurology and where the nerves exit the spine and the tissues, whether it be the skin or other structures where they innervate, where they supply that neurology. That's where the body kind of gets confused, and that's how this kind of referred pain works in simple terms. So would you say, Jacob, there's a percentage of patients that you see that have got a back pain that have got hip pain as well, or does it vary, do you find?
If we talk about true hip pain, then I think I have seen people with a real back injury and true hip joint pain, but they are very minimal. It's very seldom that I find a patient who has that, and it's either a real sports injury, very unusual, or it's someone on the older side where they've got some arthritis, some degeneration at the hip, and now they've got low back issues as well.
Yeah, and I was going to mention age, because with the hip is a hugely powerful, stable joint. So if you are young and you haven't had any significant injury, then yes, there are one or two or more conditions that directly affect the hip. But actually, if you haven't had an injury, then the likelihood of that pain being a true hip pain is quite low, I would suggest.
Exactly. It's a deep ball and socket joint, very strong capsule, very strong joint, and this joint can take a lot from running long distances to squatting heavy weights. Of course, there's a limit to it. If you would make a repetitive deep squats and you start impinging the joint too often, then you can have some problems. I've seen that as well. But in general, I think, if we look at the biomechanics, we quite often have this typical pattern recognition, as you mentioned, Ben, or a dysfunction that presents. And that would be where we sit a lot, and we don't use our glutes, our buttocks well enough, and our hamstrings, the posterior chain that suffers, then becomes weak. And so now we go for a long walk and we start getting, or these muscles start to want to protect the area, but they're not used to the conditioning. And so they cramp up. And so we have a cramped up buttock area. And so we don't use the hip properly. And then we start giving more work to the low back. And that just creates the dysfunction that we don't want. More work at the low back, less at the hip. And that just gets worse.
Yeah. So and on that note, where those that are suffering from back pain, there has been research to show reflex inhibition of some of those muscles in the buttocks, particularly glute med, which is an important stabilizer. When we're walking, when we're doing key activities. So if you're suffering from back pain and then you're going out for a long walk and those muscles aren't firing effectively, and there's no endurance there already, then the cycle of kind of vicious cycle of compounding that problem becomes a problem, because then you're starting to use, like you say, your lower back a little bit more in terms of a power generator for walking, which we definitely don't want. The flip side is, for those people that are sitting a lot, or generally our movements are very flexion based, so that posterior chain is generally weak, deconditioned in most of the population that are not focused on it or athletic or training those particular muscles. And as a result of that can then lead to back issues. So weakness around the hip can then cause your lower back problems. So it is fundamentally a hugely important platform, for want of a better term, in terms of being the power generator. And we've discussed this before in terms of movement patterns to keep the back in neutral and moving from the hip. But certainly hip pain is often a symptom described by sufferers of low back issues, rather than it being, like you say, Jacob, true hip problem discomfort. So on that note, what are some of the things that we could suggest to the listeners in terms of identifying hip pain versus lower back pain? Really, do we need some of those clinical tests? Can people self-perform some of these tests at home just to try and understand or identify if it is actually coming from the hip or the lower back?
So the first thing I think that somebody has to do is to they've got to realize that they've got to do something they've got to try to figure out whether it's a back problem or a hip problem. And it's to start off, it's very easy. You just assess your back when you get up in the morning. So you do a slight forward bending or backward bending or to the sides. Quite often at that time of the day, you'll see that if you make those movements, you'll get this light referral to either the buttock or to the front of the hip. That's the first thing. The second thing you could pay attention to is there any groin pain? Do you experience groin pain at some times? Real deep groin ache. Sometimes it refers to the knee, and this would indicate a real hip joint injury. I have patients as well. They go to a CrossFit gym, for example, and sometimes when they squat, they will actually feel pain in their groin. And this is very significant of a real hip joint injury. I think other than that, if you go to a therapist or a clinician, then I suggest you have your glute med strength checked. So the clinician therapist can test the strength of your glutes, and they should do some basic testing to see how it's going with your back.
Yeah, absolutely. I think that would be the key point. Don't be, if you are suffering from some hip discomfort and it is specifically the hip that you feel is causing you pain, then don't go to a practitioner and just accept them looking at that hip in isolation. Question, could it be coming from my lower back? Could a back problem cause that hip discomfort? And expect them to look at it holistically and to do the clinical tests to rule that out, because I think that's going to get you to where you want to be far quicker, far more efficiently, if we're looking at this holistically, looking at this as a whole. And we would always do a hip screen as part of a low back examination and vice versa, in order to rule in, rule out hip pathology of any kind. So be sure, be certain, be confident to ask those questions and challenge your therapist, your practitioner on that area, because it is important. And quite often the hip discomfort is being referred from the lower back, particularly if you're feeling more buttock type pain. Then often that can be a back issue. Groin is a little bit more difficult because groin pain is often what people experience with true hip issues, but again, that can often be referred from low back problems as well. So that becomes a little bit more difficult to identify, but again, clinical tests and a good history should elicit that information. So be confident to challenge your therapist and ask those questions and make sure that they are looking at your low back. And in terms of proactively doing things for the hips, whether you've got pain already or you are trying to avoid discomfort or strengthen your lower back and strengthen your body as a whole, some good exercises to start with, Jacob. A very good one, very low impact, safe, keeps the back in neutral, but really starts to help people re-engage with those glutes, particularly glute med, is the clamshell. Very simple, low impact exercise that's very much focused on getting that muscle firing again. I think that's something that everybody could do daily, just to start challenging that muscle and get it active and start to get that area functioning properly again, because as we say, it is such an important platform for sporting activities, endeavors, but daily activities as well, and protecting your low back. So any other exercises other than the clamshell that would be a good one to, just for people listening, to start focusing on those buttocks, focusing on the area to start to build that strength, build that endurance?
Two exercises I can think of, and the first one is the glute bridge. But I have to say, most people, when I get them to do the glute bridge straight off, tends to pull their low back hollow. So, then I usually have to correct that. And so I want to.
What do you mean by that? Just for people listening, you are we talking arching the back and overarching?
Exactly. So they arch in this case, we don't want them to arch the back at all, because any arching of the low back when you push your hips up in the glute bridge exercise means that you're using your low back muscles instead of hinging at the hips using the glutes.
Yes. So as always, we're keeping that back in neutral. That's a mantra that we will probably exhaust forevermore. But keeping that back in neutral
Exactly.
first, and employing that brace of the abdominal muscles, as always, is a start to this exercise.
But then I have to say, for a lot of people, it's going to feel like they're twisting the hips forward, and in fact, they might be working very hard to twist the hips forward to maintain that neutral spine. In other words, not arching the low back. And so don't be afraid of twisting your hips forward. And when you get to the top, not overarching the hip or not over shooting with the hips, you want to really squeeze the buttocks and maybe hold it there for 5 seconds. That's a great way to get the activation and the brain communicating to these muscles going.
Yeah, and another little tip as well for people that attempt this exercise. Often, if your glutes aren't firing effectively, maybe you're a little bit more hamstring dominant, which we want to avoid in terms of executing this exercise effectively. You can try and, if you're on a firm floor, just make sure you try and push those feet away from you a little bit as you start this exercise. That helps to switch off the hamstrings a little bit, helps you to target those glutes, so that when you are pushing up, it's coming from the glutes and less so from the hamstrings. I think that's another important little tip that helps people out with this exercise particularly. And for people listening, how much would you, in terms of sets, in terms of repetitions, in terms of holds, if they're new to this exercise, we're not going to hold too long.
3 seconds. When that goes well, you go to 5 seconds, 3 sets of 5 repetitions on a daily basis. I think if you're consistent with it, that's where you really build up this communication to the muscle groups that you need.
Yeah, and I think that's the key point. Again, we've mentioned this before, but the repetition is important. Don't worry so much about just how many you're doing on a daily basis, or lifting heavy, or all those things that often we focus on when we're in the gym, or people focus on when they're in the gym. They start to do these things and kind of go too heavy, go too extreme. You've got to be patient with these things. So being persistent and consistent is the key. So focusing on doing the clamshells every day, lying on your left hand side and just lifting that right hip up, repeating that maybe 10 times, doing the left side, repeating a few times, then doing something like the glute bridge as Jacob's just described. Try holding it for 3 seconds first of all. As you've executed that efficiently, find that easier, then increase that length of time that you hold it, but do it every single day, because doing it every single day is what's going to get those muscles firing effectively. And as you do that, then you can start to add more challenging exercises, and over time you'll create great strength in those muscles, which is hugely supportive for the lower back, as we've said before. So Jacob, some of the clinical tests that people might experience as part of an examination, just so they can be confident that they are being viewed holistically by a practitioner. So can you describe some of the tests that you use maybe, and we'll just talk about that a little bit, so people have a bit of a sense of what they should be looking for when they go to see a therapist, just to give them some idea.
Sure. Somebody comes in to my practice and they point to the hip, saying they've got this diffuse, spread out hip pain, then I have a big suspicion, and I'm almost 100% sure that it's not coming from the hip, but it's actually referral from the low back. And so I want to show to them, first of all, that it's not a hip problem, because quite often they have a strong opinion that it's coming from the hip, and maybe they've been to a therapist before telling them that it's a hip problem, and they've been treated for the hip and it just didn't get better for obvious reasons. And so then I would do a hip scouring to see what is their hip range of motion. Is there any limited range of motion? And then I would apply a little bit of pressure with internal rotation of the hip and external rotation, some axial load, and maybe some adduction compression.
So just to describe that to listeners, what we're saying here is you're going to be lying on your back, and then generally they're going to flex your knee, so bend your knee, and then we can take the thigh, the big bone in your upper leg, and apply pressure in different directions in that joint. So 360. So look at it like a clock face, and we're going to move that bone around the clock face and applying pressure and putting some tension in that joint just to identify if there is any signs of any hip pathology, something like maybe impingement. If we're pushing, let's say, your right hip across your body and applying some pressure, then maybe you're starting to get that pain in the hip. If you've got something like impingement within that hip joint, that may then start to suggest, well, it could be a hip problem. But if that scouring doesn't identify or recreate any of that pain, then we're starting to think that pain's more likely coming from somewhere else, such as the lower back.
Exactly. Right. So that's the thing. We rule out first that there's nothing going on at the hip, and usually the hip is doing perfectly fine. And so then we go to the low back, and then we will assess the low back. And I would generally, if I think of referred pain, it's quite often flexion based. In other words, and that means that if someone's flexing forward, they're reaching towards the floor, or they're reaching to get something, they will feel something in the low back. So I'll put them on a chair or on my bench, seated, have them slouched really bad, apply a bit of pressure, move their upper body to the left and right, a little bit diagonally forward, left and right, and see if there's any referral going down to the buttocks or to the hamstrings. And then I will play a little bit further with some nerve tension, straightening the leg or flexing the neck, applying. So getting the nerves to stretch a bit more from their exit points in the low back.
Yes, yeah, we're kind of trying to aggravate those structures a little bit in this scenario, just to see if we cause that reaction and cause that pain into the hip. So all of these kind of clinical tests in isolation aren't always very, very strong, but collectively they should start to build up a nice pattern of where that structure is damaged or where that problem is occurring. And really the point and the take home here is make sure that if you're seeking out some support and you're seeking out some help, that practitioner is looking at not just your hip directly, but is looking at your lower back. Because if you are younger, if you've had no significant injury, sporting or otherwise, then the chances are that it's coming from somewhere else rather than the hip joint itself. But we should always rule out that hip pathology, always see a clear history taken from the practitioner. So like we say, be confident enough to challenge them to look at your lower back as well, if they're just taking a very much focused approach on your hip in isolation, because that is underestimating the potential problem, and it's not the holistic approach we want to look for. But I think from a proactive point of view, focus on doing some of those exercises for hip function, for firing those muscles, because in today's society they're just so weak, so underestimated, and without a focus you can be increasing your risk of issues. So Jacob, anything else really to add there? I think it's a fairly straightforward episode in terms of, is it hip pain, is it back pain? But I think we both agree the majority of cases that we see that would describe hip pain are actually suffering back pain rather than it being true hip pathology. So don't be distracted by that, and make sure you're getting a full picture of the issue going on.
Yeah. So what I want to add, Ben, is that, when we talk about referral from the low back into the buttocks, what I've seen is two different types of referrals. There's the very strong referral, and that might be a trapped or impinged nerve or irritated nerve in the lower back because of inflammation, acutely or already chronic. And that would be something you can call up by creating nerve tension, and you'll see it referred to the buttock, or maybe even further down to the hamstrings, or even further down towards the foot. But we also have this spread out achy referral into the lateral side of the hip area and into the buttock, which could have different origins than a impinged nerve. And the big test for me often, I mean, I already have a good idea when I see people like this, and I see a lot of them that presents like this. The big test is after 1 week when they come back and we've fixed their movement, we've looked and made sure that they're limiting their movement through the low back so we can give it an opportunity to heal. And we've said, okay, we're going to move more through the hips. And we've done some relaxation exercises specifically for the low back and for the discs. And we've started with light glute activation, but also especially light core activation exercises. And the thing that I see is when they come back a week or maybe 2 weeks later is that, generally it's gone. So that referral down, maybe they still have a little bit of low back ache now that they're also aware of it. But the reality is that usually it's a lot better or it's almost gone. And that surprises them a lot then. But then also understanding it, they know what actually is going on. And from there we can build better patterns and a better understanding, and then they're motivated to do something about it.
Yeah, no, and again, I know I've mentioned it already, but they're more kind of bought in to doing those exercises to build the strength, to build the endurance, to build ultimately the resilience to problems down the line. Because unfortunately, the lives that we lead and the desk jobs and the sitting and probably even more sitting now, a lot of people are working from home. It's still it's August 2020 as we record this episode, so a lot of people still working from home as a result of the COVID. So a lot of these people are just not using those muscles as effectively as they should be, and that's a really big problem. So if you're listening and you haven't been suffering any significant issues, then definitely worth proactively looking at some of these exercises to start to build that resilience and start to train your body to work much more effectively. Because if everyone was doing that, then we would be seeing far lower rates of back pain and lower back problems. So Jacob, thanks as always. Guys, thanks for listening. Thanks as always for the reviews that we're getting. It's all helping to improve the show, give us a focus for the content that we create and share. As always, we really appreciate the podcast ratings that we're getting over on iTunes. So please head over there, look up the Back Pain Solutions podcast if you're listening to it on a different platform at the moment. Give us a rating, give us a review. It all helps. And as always, head on over to the website. You can contact us there with any queries, any questions. We can maybe answer those directly or answer them on the show, as we have done today, hopefully. So thanks as always for listening, and we shall speak to you again on the next show.